vaguely fall on the floor.
Your thought is that fabulous, sorry, I'm recording here, that fabulous little piece of fat in between your butt and your thigh. We all know what it is, right? That's your thought.
Yes. So buying a two-piece outfit for me was out of the question because my top was a completely different size from my bottom. And I was told everything's normal. I was on thyroid medicine, Synthroid. My tests were perfect, right? And absolutely no benefit at all. I had every symptom. My hair was falling out in clumps. I was cold all the time. My skin was dry and cracking. In the wintertime, I couldn't even shower every day. My skin would crack and bleed, is how dry it was. Didn't matter what I put on it. So you can imagine my frustration and why I started this whole process. But back then, as I said, anti-aging was the thing. It was the cool thing. Balance hormones and everything will be fine. Well, I did balance my hormones, but everything wasn't fine. I still couldn't get out and exercise and have the energy I thought I should have. Dr. Carr mentioned thyroid, cortisol, and insulin. That's your metabolic triad, right? And so there was still something wrong with my metabolic triad. I had dropped clothing sizes for sure. I started to feel and function better. But I want to touch on the thyroid. Now, other than the two of you, if you're a little lost, just ask for clarification. All of you have had your thyroid checked, and I look at your tests in a very different way. So I want to talk about that part. Right, because we have this, and Dr. Carr mentioned this normal range for blood sugar even, right? But where in the normal range are you? And with thyroid in particular, you have to think about where in the normal range are you to feel optimal. It's not about feeling okay, it's about feeling optimal. Then there's the TSH, and then there's the T4, and the T3, okay? So T4 converts into T3. And remember she said it's very important for your brain. And my brain used to be so foggy and so forgetful and, and then irritable, cranky, and everything in between, but those are the other hormones too. The very important thing to know is that we can search for estrogen, progesterone, and think we can just take them and get results. But until your cortisol, insulin, and thyroid are optimized, you're not going to get great results from the rest of your hormone balancing. And that's what was wrong with the process I started with. So when I first started, I did that whole weekend course that everybody who says they can write bioidentical hormones has taken. And all it does is tell you how to write hormones. But it doesn't tell you how to get results with patients. So remember I said when I came back it was hit and miss, like some people got great results, some people didn't. And that's when I realized that something's missing from anti-aging medicine. Because I was this traditional doctor, and what do traditional doctors do? They write medicine. You come to me, I'm going to write you a pill, right? So you have high blood pressure, I'll give you the pill. I'm not going to say what's wrong with you. What's wrong with that process that's showing up as high blood pressure? Because something's got to not be working for it to show up as high blood pressure. Because if you're normal and everything's working well, then you should have no issues, right? And so even if you have a headache, what's wrong that it's showing up as a headache? Not, here's your prescription, here's your pill, and off you go. Come back next month and we'll try something else if that didn't work. Even if you have a migraine, even if it's weather-related, I used to have 15 headaches a month or more at that point. I get none now. It's very rare. I have to be really bad with my gut. And remember Dr. Carr said 36 holes in the roof for dementia? In functional medicine, everything's related to everything else. And so my headache can be related to me exacerbating a leaky gut. And I'm going to leave it at that because, hi, come on in, have a seat. And so we're just going to leave it at that because when we do a health university, or remember the date, June 14th, because that's the date we'll dig deeper into all of these little topics, right? But leaky gut, leaky brain, leaky membranes, leaky everything, but then in anti-aging medicine, if all you're doing is putting hormones into people, how are you looking at that? You're not, right? And so we started out just being a hormone clinic, a hormone rebalancing place, and writing hormones and then realizing something's missing. So I gave women estrogen and progesterone because that's what I did as a resident in Obs and Gynae. I gave them Premarin, for example. So you came to me in it was called the menopause clinic, and I gave you Premarin. And if that didn't work, we doubled it. And if that didn't work, we doubled it again. And if that didn't work, we gave you an antidepressant. That's medicine. And so when you bring medicine thinking into anti-aging medicine, you think it's going to work. But the reason I left medicine was because it wasn't working. I was finding that a lot of what I was doing wasn't fulfilling me because my patients weren't being better. They maybe felt a little bit okay or stopped being as sick, but they weren't being restored to wellness, and that's what I wanted as a doctor. And so I transitioned from traditional medicine into anti-aging medicine and then found the same dilemma. You know, my training in rebalancing hormones, like how do you so thyroid, you know, and back then desiccated thyroid, which you were asking me about and lots of you have heard about, was like the in vogue thing. And desiccated thyroid was supposed to make all the difference to everyone, and you'll hear about it today, right? Even today, like when you're reading, how many of you come across that in your reading? Like if you're not feeling well, you should move into desiccated thyroid. We prefer not to. We're in a dilemma right now around thyroid, which I'm going to explain to you at this session, because it's that important to all of you to know what's happening with thyroid in our, I think it's our country at this moment. I'm not sure if it's continent-wise, but there's a shortage of compounded thyroid. Anyway, so they teach us how to write these hormones, but again, the critical thinking of what actually is wrong is missing. Right? Because the patient comes in, they have thyroid symptoms, and they're saying, oh, well, Synthroid doesn't work, which I knew, because I was living proof of it. And then it was like, okay, give everybody desiccated thyroid, which I started doing. And then I took that same traditional medicine thinking, and you had, I'm going to just pick on you, hot flashes. I don't know if she has hot flashes or not, but we're just going to make her have hot flashes. So she comes in and she says, I have hot flashes. I go, oh, look, I'm not going to give you Premarin because I'm now in anti-aging medicine, so I'm just going to write you bioidentical estrogen. And I'm going to write you bioidentical progesterone. Is everybody familiar with what bioidentical is, right? So bioidentical means natural and identical to what your body makes rather than a synthetic substance. So desiccated thyroid is bioidentical to a pig. Premarin is bioidentical to a horse. Estradiol is bioidentical to a human. So it's created in a lab to look exactly like what your body makes. And again, I was faced with the same dilemma that I was faced with when I walked out of traditional medicine and got into this anti-aging field. That some people were responding and not everyone was getting well. Not everyone was feeling optimized. And I knew that at 31, if I felt like I was 50 thinking, oh my gosh, if this is what it feels like to be 31, I don't want to know what it feels like to be 50 or 60. And I've had many patients come to me and say that. They'll say, if this is what it feels like to be 49, I don't want to feel 50. I don't want to know what 70 is like. Like, shoot me now. Make me feel better or else. Like, I feel so bad. And I start rethinking my approach to what we were doing and how we were doing it. And that's when the Cronus Apollo transition into Better really worked well, because our whole focus was changing into expanding into the functional medicine concept. Right? So functional medicine is asking that question. And you know how to come around back to if you need to. That's Malia. She'll be talking about you later. So in functional medicine, it's really asking, what is that reason you have the high blood pressure? What is the reason you have the headache? What is the reason you have no energy? Because no energy could be thyroid. Could it be nutrients from which you make energy? Could it be something blocking the energy cycle? It could be any of those things. Could it be that you're just depleted and you need more of something? Well, whatever it could be, there's a reason. But I'm not just going to go, oh, you have no energy here, let's give you some thyroid. Right? So it's always asking that question, why? What's the underlying process? And that's why I like the term functional medicine as opposed to anti-aging medicine. The premise to anti-aging is all the same, though. You'll hear me say these words all the time. You age because your hormone levels decline. Your hormone levels do not decline because you're aging. How many of you have heard me say that? It's like my favorite saying in the world, right? Why? Because when I was working in the menopause clinic, what was the thing? First, we never tested and treated. You had hot flashes, we'd just write your prescription. because hot flashes must mean estrogen is deficient. Did you know that today more than half of our patients have hot flashes that don't respond to only estrogen? Right? Because it has so many other factors that influence it. And until you fix those, that's why we can use such minimal and safe dosing of hormones. Don't think that because it's bioidentical, it's perfectly natural and safe. You can still have side effects. You can still be at increased risk for cancer, right? And all of these things were missing in the anti-aging practice, which was very much like the traditional practice of writing hormones, just giving it to you, sending you on your way, giving you more change. So the testing was missing, the balancing was missing, and the understanding of what else needs to be done in that process of hormone rebalancing. So you age because your hormone levels decline. We know this through studies where we see, when we study the communities that have the healthiest, oldest people, so people in their late 90s, 100s, being active, vital, what do we see? They manage their hormone levels and they maintain them to that of younger people naturally through their lifestyle and how their bodies work. So that's how this field got started. And in medicine, though, we say, oh, you're old, your levels are low, so we'll just give them to you. Or it's normal to not have any, so just do without. Right? If we test a 60 or 70-year-old woman for estrogen, we expect it to be low, and we're going to go, oh, that's normal for you. In medicine, traditional allopathic medicine. For me, I'm going to look at you and say, what's optimal for you? And how old do you want to be? Because as far as I'm concerned, I mean, look where I started, and this is not just about the looks. Last night I told you, last night I was playing soccer with my 10-year-old, right? And running up hills and racing across the backyard and keeping up with him. So I don't want things to dry up, shrivel up, and fall out on me as I get older. I just want to be young and vibrant and healthy, right? But isn't it expected that you have things dry up, shrivel up, and fall out on you as you get old? And you go to the doctor and he goes, oh, you're just getting old. How many of you heard that? Yeah, you're just getting older, deal with it. No, you don't have to deal with it. Because we get to choose how we age, and it comes from balancing hormones. And how young and vital do you want to feel? It comes from balancing hormones. However, it's not as simple as just throwing a prescription at you.